forums in the Star of Mysore to speak on a very interesting subject, which affects all of us, all the geriatrics who are members of this forum. Let us treat the disease and not the lab reports. That is the subject, which I find is a very interesting subject, because we all go to London pathological lab and come back worried about our lab reports. So then we go and ask him, what does it mean? So today he's going to explain to us, what does it mean? So I have some very important people here. Professor Jamil Ahmed has come, and Professor Basuraju has come, who has today been awarded the Professor Emeritus at Rajiv Gandhi Health University in Bangalore. Now he is in Mysore. Jesus.
Wonderful to see a full house. Speaks to the popularity of our speaker today, Dr. Javed Naeem. With a little bit of twisting the meaning, I read his name means happy historian. Issues of medical ethics, etc. So he's been a very interesting person, very wide-ranging set of thoughts, and secretly he told me he's been a very naughty person, but he instructed me not to bring that up. So I was in our midst today for a
privileged and honored to have been invited to deliver a talk before such a learned audience, because everyone who is sitting in front of me has got his or her own eminence, before which my stature pales a little. And I hope I live up to your expectations in delivering this talk and the message that I want to give you. I have made the title a little mischievous. Yes, treat the disease, not the lab reports. But this is not going to be any sensitive issue. I am not going to touch on anything sensitive, anything a little uncomfortable, anything a little unnerving. No. Only the title sounds like that. But our society, thanks to the growing knowledge about so many things, a little. Very often what happens, and I have lived in both the eras, when there were no lab tests. I come from the time I became a doctor when there was nothing called ultrasound also. The simplest of scans available today, the ultrasound, which is the most harmless scan also. Before this came, I became a doctor. After I completed my MD in the year 1985, the ultrasound came to Mysore. Till then it was not there. So I have lived in both the eras. I have been trained in both the eras of clinical diagnosing based on clinical medicine and diagnosing based on the support of lab tests. So that is why I feel I am able to analyze what has gone wrong with some capability. Not very long ago, when lab tests used to be done only on the orders of a doctor. If a person went to a doctor, the doctor would listen to the patient first, something we don't do today, sadly. We don't do. I think anybody who has gone to a doctor here, at least 70% of them will agree that they came out of the doctor's clinics wishing that the doctor had a little more time to listen to them. So, what is happening is, we don't have the time to listen to patients. The moment somebody comes with little fever, backache, body ache, cough, we straight away order complete blood counts, one chest X-ray. If the fever has got little chills added to it, yes, add a urine examination also, because urinary tract infection. The patient used to give us the diagnosis. I had a professor of medicine, no lab tests. Lab tests would be ordered only when you went to a doctor, and the doctor would ask only for what he wanted, just 2 or 3 tests. There was no question of getting a complete test done, a whole body test done, a whole body scan done, nothing like that. Then came the era of health packages. This is about 15 years old. This was necessitated by a few things, situations. What were they? Life insurance, if you have to get a good life insurance cover, you have to prove that you are healthy enough to be insured. So your basic health test would not be enough, because they were insuring your health and they did not want to make a mistake and go wrong somewhere. So everything from the color of your stools, color of your urine, that had to be recorded in your health report. That is how things were. So this happened. When this happened, as a natural consequence, labs decided that they would offer packages at a discounted price. If your doctor asked for blood tests, blood counts, X-ray, urine test, and a Vidal test for typhoid, the lab would tell you this whole thing costs you about 1,200 rupees. You pay us 2,000 rupees, we'll give you 55 tests all in one bundle. Started. These days, if you go to a place where there are many hotels, you will read boards, bucket biryani. For about 1,200 rupees or 1,400 rupees, they'll say you get a bucket of biryani that is good enough for 4 people, so many pieces of mutton and so many pieces of chicken coming with it. Labs, which did not have any accreditation by any health bodies, health authorities, they started doing these tests. Small labs in the lane somewhere, you don't even know the address of the land, you only know the phone number. Why? Because the moment you ring, the technician comes home, collects your blood sample, collects your urine sample, takes it, gets it analyzed, where you do not know. In what conditions you do not know. Under what standards, quality standards, you do not know. He brings a report, 55 pages, and hands it over to you. You feel very happy, because the same package bucket lab test that was offered by a reputed lab, like what Ravi Joshi said, for about 2,000 rupees, this on the street roadside lab man provides you at 700 or 800 rupees. Very will tell you whether you are going to get 50 cancers for which it's going to test your blood. With one sample of blood, this test claims to tell you the probability of you getting 50 types of cancer. What a dangerous diagnosis. Why would I want to know about this? The incidence of cancer in the society today is 4%. If there are 100 people sitting here in this hall, 4 of us are going to die of cancer. It can be anybody. That is certain. 4 of us are going to get 4% of all individuals in society are going to get cancer at some time or the other. 90% of these cancers, if they are detected early, are treatable 100%. So where is the despair? Where is the shock? And this test is going to tell you in advance, out of these 50 cancers, these are the 13 cancers which you are likely to get. We are going to do a whole cancer screening for your family. Why don't you get it done, sir, free of cost? I said, no, please stay out of my clinic. Do not come near me, because I am happy to face an uncertain future, because the probabilities there are more encouraging than what I would have after reading your report. So these are the things. So bucket test came. Getting tested became a fad. And when you get a battery of tests done like this, for no reason at all, these tests will certainly uncover some abnormality or the other here and there. If you get your lipid profile done, when you don't have any symptoms, you don't have any problems, you don't have diabetes, nothing, that lipid profile shows a little bit of elevated cholesterol, a little bit elevation of triglyceride, or what we call low density lipoprotein, LDL. The moment a layman sees this abnormality, he or she gets worried. Why? What alerts them? What tells them that this is abnormality? When this packet of lab reports comes, all the abnormal lab reports out of range are marked in red, or they are highlighted in bold letters. So the moment this report comes, nowadays every patient who is literate, he starts Googling every highlighted value. After doing that, he will start writing notes about these things, preparing for the examination where he has to face the doctor And when he faces the doctor, it is not the patient who faces the examination, it is the doctor who faces the examination. All the resources. That meta-analysis of a few million patients has shown that cholesterol is not as bad a culprit as we have made it today. We should treat the patient, we should treat the person behind the disease and not the cholesterol, not the lab report. And every lab report is going to show something abnormal like this. You get a scan done, you will find 3 or 4 stones in each kidney. You will find a gallstone in your gallbladder. You will find a small cyst in the kidney. You will find a small hemangioma in the liver. A hemangioma is only a collection, a bundle of blood vessels, small blood vessels coiled together. It does nothing wrong to you. So you will find some abnormality because these imaging machines are made to detect abnormalities. They should screen the abnormalities. So they'll give out something like that, a cyst or a hemangioma or a small nodule in the breast which is not cancerous. These things. And when people see the alarmed, and when they get alarmed, it is the duty of the doctor to reassure them that there is nothing wrong. And doctors do it also. See, doctors just don't go on treating symptom and non-symptomatic kidney stones, non-symptomatic gallstones. But I must admit as a doctor that there are some very unscrupulous people, probably who are bereft of practice, who are not happy with the amount of money they are making, who will say, no, let us treat this, we'll operate you for this gallstone, we'll operate you for this kidney stone, we'll extract this kidney stone by this method, and all these things. It happens. After all, you may have these side effects. If I give aspirin to prevent heart attacks in your case, that aspirin can have side effects. If your blood pressure goes up a little, that aspirin can cause a massive bleed inside your brain, give you a hemorrhagic stroke. But this patient is not convinced because that phantom of abnormal result in his hand torments his mind. And triglyceride, they can be reduced. But if there are so many other abnormalities, a slightly elevated liver function test, whatever you do, allopathic or Ayurvedic, my friend Dr. Guru Basuraj is here, a very eminent Ayurvedic physician. Whether you come to me or whether you go to him, we cannot do anything about it together. We have to accept this. But that slight liver function abnormality, that slight cholesterol abnormality, that slight renal function abnormality, that slightly elevated platelet count in the blood, the slightly elevated WBC count in the blood, they are not going to harm us in any way throughout our lives. We can lead a normal life with them. Yet, people insist on getting them treated. And because, as I said, they cannot be corrected effectively by any modality of treatment, they will continue to be there. And every time the test is repeated, they will continue to torment the patient and steal away his or her peace of mind. Specifically, is capable of diagnosing a disease which you are trying to find out. Sensitivity is how good the test is in diagnosing. Both these factors are very important things which you must take into consideration when you interpret a lab report. See, the typhoid test I was talking about, Vidal, if it is positive, it doesn't 100% mean that the person has typhoid. That can cause a positive test in the Vidal. It looks for salmonella bacteria, not a very specific test. You can have salmonella bacteria from eating pani puri on the roadside. But that doesn't mean that a positive Vidal test makes it clear that you have got typhoid. So the specificity is not very good. You have got a test for dengue fever. The dengue test, which is the commonest test that we have been doing over the past 3 years for every patient who comes with fever. A small slide which comes with 2 marks there telling you that it's positive for dengue. But a dengue fever positive test does not mean that the patient has got dengue fever and it needs to be treated for dengue. There is no treatment for dengue incidentally. The dengue test, when it comes positive, gains some significance if there is an associated problem in that patient. If the patient's platelet count is falling drastically, If that patient has got some bleeding problems, then you can put 2 and 2 together and say a positive dengue test plus this low platelet count plus the bleeding diathesis, these things make it almost clear that the patient has got dengue. Problem has started. I also have it. Yes. So what happens? The bones in our neck, they start getting a little rough. And because they become a little rough, from between every bone, a nerve comes out of the spinal cord. And these rough bones will start rubbing against or pressing against some of the nerves. And when this happens, that creates a little bit of pain. When it is a very agonizing kind of pain, the cause is easy to find. There will be a disc problem or something like that that can be corrected by surgery. But when the problem is very mild, the pain is going to be persistent. The pain is going to nag you every day, going to be severe when you wake up in the mornings, little better throughout the day, but there is nothing about it which you can do or which your doctor can do. No doctor can cure this. Why? You cannot be putting new vertebrae in your neck, buying it from the medical shop. It's not available yet. Those days may come. People may start doing printing of vertebrae. They are printing everything. You are demanding poison to be given to you because there is no drug in this world which does not have a side effect. I tell my patients why I don't treat them for some small problems. And I always tell them that any drug in this world which does not have a side effect has no effect also. Paracetamol can kill you, but it doesn't kill everybody. Out of 1 million people, 10 people die of paracetamol poisoning. That's why we take. So, doing this is going to reveal the side effects. So that is why we should not give a pill for every ill. Having said all this, I don't think I have to say much, but I'll just check the list that I have brought here of what I should have told you. See, I generally don't go to any lecture, deliver any lecture with any notes. But today I have brought a small checklist because today is a technical subject where I should not miss out on anything. As I said, some medicines can have side effects which are worse than the effects, worse than the benefits. There are some tests also which are worse than the disease, which can turn out to be worse than the disease. This is what you should take home from here. When you ask a doctor to perform tests, to keep on diagnosing what is wrong with them and why they are having these symptoms, you must keep in mind the disadvantage and the harmful effects of these tests also. See, when you ask for scans, very often a dye has to be injected into your body, a chemical. When you ask for an angiogram or a renogram for your kidney, a dye has to be injected before it can show you what is wrong. Very often these dyes themselves are very harmful, not for every patient. Out of 10,000 people, 1% will turn out to be allergic to these dyes. And these allergies can be very, very serious. They can cause a complete and sometimes an irreversible shutdown of the kidneys, requiring dialysis. Sometimes they can give a violent reaction which can threaten the patient's life unless it's corrected very quickly. So these are the chemical dangers of these dyes. But even the other scans also have their pitfalls. See, when you take an X-ray, you get a certain amount of radiation into your body. There is what is called background radiation. All of us are getting it here. Sitting in this room, we are all getting our dose of background radiation from the sunlight that is coming in. Standing under the tree there, outside this house, we will be getting our background radiation from the soil that is there, from the sunlight that falls on us. All that is radiation. But it is not enough to kill us. But when you get an X-ray done or a mammogram done, that induces an extra dose of radiation into the body. And this radiation occasionally is again not harmful. Maybe if you have an X-ray once in 3 years or 4 years, 6 or 7 times in your lifetime, nothing wrong with it. But we still tell the patients, don't take repeated X-rays. They can give you more radiation and cause cancers to grow in your body. That is why we tell every pregnant patient or any lady who has missed her periods to tell us whether she is pregnant, or even get a pregnancy test done before coming for a simple chest X-ray or for the X-ray of a simple fracture of the wrist. Because that X-ray is radiation, and that radiation can cause abnormalities in the unborn child, the fetus in the womb. So radiation is confirmed to be harmful. There are no two thoughts about this. Now, look at the scenario today. For everything, one of the very common tests is a CT scan. Why? It tells us 10 times more than what an X-ray can tell us. Simple X-ray. It fails to tell us something. What do we say next? Get a CT scan done. When we get a CT scan done, it's a simple job. Unlike a MRI scan, which takes sometimes even 1 hour to do, a CT scan takes only 5 minutes. You have to lie down, in 5 minutes the scan is over, in 10 minutes the report comes from the computer. The CT scan being such a simple thing, we order it left and right today to make a diagnosis. We are not sure about something, we make a diagnosis based on the CT scan. We are forced to, because if I don't do it, just because I am scared of a CT scan, if I tell the patient, your X-ray is not revealing anything much, anyway we'll treat and see, that patient will go to some other doctor who will tell him, what is this? This doctor is stupid, he doesn't know that a CT scan can help. Please go and get a CT scan done. It will cost you only 1,700 rupees and we'll have the diagnosis in 15 minutes. So, because of this scenario, patients also have started now demanding CT scans. ಒಂದು ಎಕ್ಸ್ರೇ ಮಾಡಿಸ್ಕೊಂಬನಿ ಸರ್ ಎಕ್ಸ್ರೇ ಯಾಕೆ ಸರ್ CT ಸ್ಕ್ಯಾನೇ ಮಾಡಿಸ್ತಾರೆ ಪರವಾಗಿಲ್ಲ ಒಂದು 1,000 ರೂಪಾಯಿ ಜಾಸ್ತಿ ಆದರೆ on insisting on CT scans. And many patients, before coming to a doctor for any pain, for any small ache, they first go to a lab, ask for a CT scan, get it done and bring it to our consultation at the first visit itself. What they do not know is, when an X-ray, the amount of radiation that is there in an X-ray is harmful to the body, so harmful to the fetus that it can cause fetal abnormalities. A CT scan gives 400 times the dosage of radiation that an X-ray gives. X-ray gives. How many people know this? That is where every patient should know what to ask for and what not to ask for. Self-medication is known to be bad. Self-testing is also not without its hazards. So these are very, very harmful things which people should know. And presuming that I have made myself clear, made some impact on your minds about what I wanted to say today, I would like to give you some illustrations of what can go wrong if we don't keep these things in mind. Some time ago, my own neighbor, a lady, she came, were expected, were common, she was getting treated. When the winter came, these coughs and wheezes became more common. And I had not taken an X-ray because I didn't feel it was necessary. There were no new symptoms. But somebody suggested to her that she should have an X-ray. When she had an X-ray, there was a small white patch in the X-ray. She brought that X-ray and told me, see, there is this white patch. No doctor in the first instance can look at a white patch and say white is there in an X-ray. It's not possible. So I thought it was a patch of pneumonia and told her, don't worry, we'll treat this pneumonia. It's going to heal. I gave her the best course of antibiotics. And 6 weeks later, that patch had not changed 1 millimeter. It had remained just like that. That is when I presumed, by my training, that this is a patch of old tuberculosis. This is a scar of old tuberculosis. And I reassured the family and told them, this looks like a patch of tuberculosis which has come and gone. Every one of us, not a single exception in this hall, would have had a tubercular infection sometime in our childhood. All of us. And that would have gone away without any treatment, without any diagnosis. But sometimes those infections can leave a small patch and small nodule in the chest X-ray. That is why people in other countries are so scared of tuberculosis which they have not seen, which we experience regularly here, that even if they find a small white spot in the X-ray, they'll reject that person for employment in Australia or Saudi Arabia or Qatar or Dubai. You cannot go to these countries if there is a small patch in your chest X-ray. A simple doctor like me will know for sure that this is harmless, this is only a residual picture of what has happened 30 years ago. But they will not accept it because they are scared that India is full of tuberculosis and anybody who comes from India for employment with a patch like this is going to infect them with tuberculosis. So she had a small patch. I reassured the family that this patch was absolutely harmless and we don't have to do anything about it. Close friend's wife, she came to see me. She had an intractable pain of the neck radiating to the arm. At least 10 specialists had seen her, neurologists, orthopedicians, physicians. No comorbidities. She did not have blood pressure, she did not have diabetes, she was not overweight, she was very fit, healthy, well built. She was having this pain. She had seen at least 10 people. And she came to me in desperation. I looked at her records. Every possible modality of treatment available to modern medicine today had been tried on her with absolutely no results. I told you in the beginning itself that every symptom cannot be cured by any medicine available today. There are some symptoms which you have to leave them alone. Just leave them alone, forget about it and enjoy your life. So it had been tried. Then somebody told her this may be due to toxins in the body. So you better get a toxin test done. A new test has come. It is called Elements 22. You can go home, Google and see. Elements 22 test. This Elements 22 test is supposed to measure the levels of 22 different elements in your blood. Some of which can be toxic and some of which can be deficient. So a less amount of some element and an excess of some element can be detected by this test. Yeah, this Elements 22 test. It's available. Again, a very expensive test. This Elements 22 test I have never ordered in 40 years of my practice. Why? Because it can leave you in a catch-22 situation. Most of you are aware of what this catch-22 situation is. Catch-22 is derived from the title of a book by Joseph Heller, who wrote it in 1951 about a problem in the Second World War. What was this problem? A soldier was fighting in the war, an American soldier. It is a fictional book, not a real incident. If a soldier was fighting in the World War, an American soldier, he felt a kind of remorse that he was killing people and it was not a good job to be in. So he decides to leave the army. But to get out of the army, you need an excuse. So he says his mind is not working well, so he wants to leave the army on the grounds of insanity, mild insanity. He says, in my insanity I may do something wrong in the army, so I want to leave the army. But the army has a rule that the insanity must be proved by a doctor, medical doctor who should examine him. So when the army doctor examines him, the army doctor gives a report, not to the patient but to the army headquarters. This man claims to be insane, but he knows very well that insanity is necessary before discharge from the army. When he is sane enough to do this, he doesn't qualify to be called insane. So you cannot give him voluntary retirement. So that man is caught in an insane situation. That is why the term catch-22 has come. Catch-22, another example is, the moment an engineer goes with his degree asking for employment, they'll say, sorry, you don't have any experience, you have just passed out of college last month, so till you get some experience, we cannot give you a job. And unless somebody gives this poor fellow a job, where can he get the experience? So he goes from door to door, door to door. Every employer wants only experienced people. So this is again a catch-22 situation. A very humorous catch-22 situation also I'll tell you. There is a Gade in Kannada. There's a madman who wants to get married. Nobody is willing to give him a wife because he is not normal. So the Gade says, "Huch bida tanka madve agalla, madve aga tanka huch bida." So it is like that. So they got this elements 22 test done, and then it went into a catch-22 situation. That test showed everything normal, but it showed mercury levels little high. Mercury is a very, very toxic substance. Dimethyl mercury, you don't have to drink it to die. Dimethyl mercury, if it touches your skin, you die. Please go and check. Dimethyl mercury. If you want to test whether you will die out of dimethyl mercury, my word is enough for you. You don't try it at home.
Next time your talk, this hall will be empty.
If all of you try it. So, mercury levels were shown to be little high. How high? The normal level of mercury is 0. Our body should not have any mercury in the body, because it's not something that we eat, something that we drink. Only people who live in the coastal areas, who eat lot of sea fish, they get a little mercury in their body because they eat fish which consumes seafood, lot of seawater having mercury. And jewelers, they use mercury to make amalgams out of gold and silver, so they get a little bit of mercury poisoning. But you don't hear of any jeweler dying of mercury poisoning. We don't hear of a higher incidence of deaths from mercury poisoning in Mangalore or Madras or Bombay. No. So in her report, the only thing that showed a little abnormality was the mercury level. The mercury level was shown to be 5 nanograms. And seeing this only abnormal report, the doctor who ordered this ordered this catch-22 test, he told her that there is a friend of his who will do chelation therapy to remove this mercury from the body. Now, chelation therapy, for those who do not know what it is a therapy where we inject a substance that can bind with the toxic substance, and when it is excreted, the toxic substance also comes out of the body in the urine or the feces. This is chelation therapy. So they advised her chelation therapy for mercury. Very costly treatment, 20,000 rupees only per session. They said you have to go through 20 cycles of this to get the mercury out of your body. So this lady and her husband, they pooled their resources, somehow managed to get money and started this chelation therapy. When 10 cycles of chelation therapy did not help her pain, they asked the doctor, what is this? We are not getting any benefit. No. You will get the benefit only after all the mercury comes out.
Or the payment is made. Payment is made.
So they continued. At the 17th cycle of chelation, somebody brought them to me. And I saw this. It seemed very, very, very outlandish to me. I told her to show me the reports. I saw the report said everything normal, only mercury high, 5 nanograms of mercury. I told them, please check in the Google. to do any kind of harm, to cause any kind of discomfort to you, let alone to kill you, you need 300 nanograms of mercury in your blood, and what you have is 5.8. So this mercury cannot be made to stand in the witness box as a culprit. It is just an incidental finding because of a test which is not a very authentic test, not a necessary test. We don't do it every day. Not cure you completely, but it's certainly going to help you. It's going to be very expensive. If you are willing to take it, I'll write. They said, sir, we have spent so much of money, no harm in trying your medicine. You please tell us how much it costs and we will take the drug. I prescribed a tablet called Gabavin 25 milligrams, Gabapentin 25 milligrams. The cost of the drug is 7 rupees per tablet. I wrote it and told her, you take this, if you feel better, you continue to take it lifelong. If you stop it and if it comes back, restart it and do it. 50% of her pain is gone to manage because of the reassurance she has got, because she has got the partial relief from the tablet. Because there was a very eminent pediatrician. There's another eminent pediatrician sitting here, Wing Commander Rajiv, my very close friend. Sir, please get up and wave out to them at least. Let them see what kind of good friends I have. He and his wife Kala, she's a medical officer in the CFTRI, an ophthalmologist. She's sitting here. So this man also was a pediatrician. He is the wing commander, incidentally, Rajiv. This man also was a pediatrician, Sir Robert Hutchison. He has written many books, but the best book he has written is a book called Hutchison's Clinical Methods. This is the first book, along with the Gray's Anatomy, which every medical student has to buy as soon as he joins medical college. For anatomy, it is Gray's Anatomy. For physiology, it is Hutchison's Clinical Methods. This Hutchison's Clinical Methods tells you how to examine a patient, how to talk to a patient, how to examine and get information from the patient's symptoms. And this is the most basic book in medicine. And in the foreword of that book, Sir Hutchison writes a prayer which I want to read out to you now. And this prayer is something I turn to very often in my life. Very often I look at it. Very often I introspect on this, because I believe that believing in this prayer has helped me to do some good and leave a good impression on my patients. Though not made me a famous doctor. Sir Hutchison says, please reflect on every word. In 28 words, Hutchison has said this. From putting knowledge before wisdom, science before art, and cleverness before common sense. From treating patients as mere cases, and from making the cure of the disease more painful than the endurance of the same, good Lord, deliver us.
We should have preset standards, and this evolves from something called QCI, Quality Council of India, which is a quasi-government body where eminent persons are there. There are two things into that. One is NABH, National Accreditation Board for Hospitals, for which I was a technical member way back in 2002. And then the second is NABL, National Accreditation Board for Labs. Lab is nothing like only medical labs. There are so many labs, like CFTRI labs are there. There are so many labs which are there. They have their own preset standards. You have the objective elements, and we have the audits from the external auditors who come there and have a thorough check. What they say or what they give the report is more or less is conforming to preset standards level, because it is being accredited to ISQA. ISQA is International Quality Assurance Board. Okay, it's the international board. Now, main thing what I want to add, only one thing, which is permission and the permission of this thing. Over a period of time, what is happening, what we find, because I have been mainly into administration now, is over a period of time, the subjectivity in our medical field is getting less and less. It should be subjective. You should have curves, it should have lines. If it is straight, then nothing is. You should have curves in your line. So similarly, one more thing, most important thing about the lab and lab test is, because I'm talking from the physicians and the healthcare point of view, our workers' point of view is legality. Nowadays, the judiciary unfortunately is not going to recognize what has been deduced by us and what was we have to, even if you explain how you arrived at a diagnosis, not been recognized until unless you have a backup. The backup is this lab report.
Percent of abnormality.
Yes, sir.
Minor and you get it checked very
True.
Why should we?
No.
Body abnormal.
I'm not surprised. I've heard you twice to speak, I mean, when you spoke here in the same auditorium about your joining the medical profession. Wonderful. And today, of course, I was more keen and eager because Dr. Javed Naim, thanks to his columns, what makes him special is his solid common sense. And
Humor.
what I liked most was the examples you gave. Phenomenal examples. And
Is a shadow of something that is kept there. From here, I cannot say what shadow that is, what is inside it, whether it's a bomb or just a empty box or it contains some kind of other substance. So any scan is only an interpretation of a shadow. Only when you take a biopsy, only when you do an analysis, when you test it chemically, only then you come to know what kind of shadow.
There must be some sort of rationality in finding out why those abnormalities are detected by the lab tests. There must be some meta-analysis which has been done, right throughout all the cases, and where you.
Please sit down, sir.
Thank you.
See, the domain of human knowledge has to stop somewhere, despite all the advances. Otherwise, men would have become gods.
Professor Badiya said, so the main driver of these tests, lab tests and other things is the commercial motive.
Start with a quote, just to say that everybody's talking about the gullibility, mass gullibility or whatever, or the heartlessness of the doctors. But you probably know Rudolf Virchow, who's considered the father of pathology. He said medical science is social science. The point I'm trying to say is we all have to understand that each one of us as a patient also have a responsibility. We have to be the patient or the patient's family rather than another doctor.
I pray none of you have the need to go to any doctor. But I also pray to God. I tell God, keep everybody healthy. But if somebody becomes unhealthy, please send them to me. Hey, madam.
As a common sense category, you can brush off my question if it's not very.
No question is going to be brushed off because no question is silly or pointless.
Okay, I'll spell out. There are two things. One, doctors are not ಅವ್ರಿಗೆ ಫುಲ್ ಒಂದು ಔಷಧದ ಫುಲ್ ಕೆಮಿಸ್ಟ್ರಿ ಆರ್ ಆರ್ಗ್ಯಾನಿಕ್ ಕೆಮಿಸ್ಟ್ರಿ ಪಾರ್ಟ್ ಆಫ್ ಇಟ್ ಅವ್ರಿಗೆ ತಿಳಿದಿರೋದಿಲ್ಲ. Similarly, a pharma person does not know the pathology or the physiology of it. ಅವ್ರು ಒಂದ್ಸಲ ಡೈರೆಕ್ಟ್ ಆಗಿ ಪ್ರಿಸ್ಕ್ರೈಬ್ ಮಾಡ್ಬಿಡ್ತಾರೆ. ನೋಡಿ ನೀವು ಹೇಳಿದವಾಗ are all the doctors aware of the side effects of the medicines that they are prescribing? Point number one. Point number two, what is the medical world doing? The side effects ಗೆ ಸ್ವಲ್ಪ annihilate ಮಾಡೋಕ್ಕೆ ಕಡಿಮೆ ಮಾಡಲಿಕ್ಕೆ ಅಥವಾ how they.
Thank you, madam. See, the awareness about side effects of medicines and medical treatment needs to be created in society, especially in an educated society. For that, we can achieve it only through lectures, interactions like this. And he said, I went to this doctor, he saw this thyroid related thing and said, I've got thyroid problem, he has put me on thyroid tablets.
Yeah.
Because this is the only place where it is regularly.
I have become an admirer of Dr.
Thank you, sir. Thank you.
When we become only when you are here. Medically, I cannot question it. But about the accreditation, because many people bothered about accreditation. Krishna Rao has made it that how there is a body, and that these people are taking by and giving A++. And they were caught in India, throughout India, they have been selected as the best students. That is how we bother very much about accreditation. About universities, we don't bother. Because whether A++, my soul into medical science.
Independence in 1945.
Doctor, I have a question. This is the latest fad, or say my 10 years. Lot of fad on multivitamins, then calcium and all that. Everywhere people speak that. What is your take on that?
See, if eating the traditional Indian diet, the ele uta, which is my favorite uta. My wife and I know very well that the only thing I relish, even if woken up in the middle of the night, is a bala ele uta. Eating a traditional ele uta, you look at the things that go in a line there, from a slight B complex deficiency, B12 deficiency, if they don't take meat products. Alone is not very suitable in giving us enough B12. So if multivitamin supplement, and for ladies, elderly ladies, a little bit of calcium also.
Hello doctor, this is just an extension of what she asked about the supplements. But these days I see youngsters just popping up these pills. They are young and I don't think so it is necessary, but they say it is very required because we don't find anything. Is there any goodness in popping out those pills? They take 2 to 3.
Thank you, madam. That's a very good question you asked, because girls meet boys in the gym and they get married. So gym is a very good place for these days. So a lot of people do a lot of gymming, and the gym instructor, he tells them, when you do a lot of gymming, you are burning a lot of fat. So you must have a protein supplement because you have to build up muscle. So they advise a lot of protein supplements. And some people who do gymming, they eat about 6 or 8 eggs every day, the white of an egg, which is a lot of protein. And they also give protein supplements, creatine and all these things, and say that this is good for the gymmers. They are not good. See, eating so. Is this your vote of thanks?
Yeah.
Professor Beliappa complimented the quality of the examples I gave you today. I feel I should tell you one more incident.
Please do.
Metal shop, metal utensil shop. He has got a lot of infinite faith in me. Anything in his family, he comes only to me, and he doesn't go to anybody without my advice, whatever specialist it is. One day he came and said, I have got a relative, a brother-in-law in Erode. He is very upset, very depressed. Nobody is able to help him. Can I bring him to you for treatment? I said, please. That man brought him. He said, what is your problem? He said, I have been trying to change my blood group. And none of the doctors are able to help me. I went to so many centers and asked, can my blood group be changed? I read about it also. They say blood group, once you get it in your life, it is over. You're stuck with it for life. You cannot change it. Sir, but I have been told my blood group is hopeless. I said, what? How can somebody say your blood group is hopeless? Where are the records? I'll show you. He opened the file, he gave me the records. I saw his blood. He had O group plus and RH plus.
Oh, plus.
And that doctor had told him his blood group was O plus. He thought it was hopeless.